Involuntary Inpatient Psychiatric Treatment by Gloria Johnson. Basic needs such as food, water, clothing, shelter, or medical care are essential for survival, but some people are able to care for their needs due to mental illness. Criteria for involuntary commitment include a danger to self or others, grave disability, or severe psychiatric symptoms such as schizophrenia and bipolar disorders, characterized by aggressive behavior and precarious social conditions. Recognizing the need to seek treatment. Hallucinations or delusions, which are disruptions in daily functioning, difficulty coping with stress, or withdrawals from activities or people, and inability to communicate with others. Severe mood swings, persistent sadness, irritability, or euphoria, overwhelming anxiety and fears that interfere with daily life, but talking to someone inpatient can become a positive element of an inpatient care. Self-harm or suicidal ideation, expressing thoughts of harming themselves or others that are disruptive to daily functioning and cause for difficult coping with stress. Substance abuse, reliance on drugs or alcohol to cope, causing difficulty maintaining work, relationships, or hygiene, and an overwhelming anxiety or fear that interferes with our daily life. Who can initiate the process of involuntary inpatient psychiatric treatment are usually family members and close friends who interact with individuals daily. Other people who can initiate the process for involuntary inpatient psychiatric treatment are health professionals, social workers, or counselors that have interacted with individuals who have identified certain characteristics. In addition, police officers, first responders, or crisis responders can be individuals who initiate the process for involuntary inpatient psychiatric treatment. When discussing the need for treatment, choose the right time and place, express concern without judgment, be empathetic and patient, offer support, and always provide information. When a loved one refuses treatment, stay engaged, educate yourself, involve others, consult professionals, and safety first. Don't hesitate to involve emergency services and local crisis response teams as needed. Remember, all individuals have a right for due process, which is a right for legal representation, treatment, a right to refuse treatment with exceptions, and confidentiality to handle their privacy. The legal process is a petition for commitment with the court. If the application for a warrant is approved, a warrant is issued. The local sheriff will locate and detain the individual, transport the individual to a local mental health facility. This warrant serves as a magistrate's order of emergency apprehension and detainment. A doctor will examine you within 12 to 24 hours of arriving to the facility. You may not be detained for more than 24 to 48 hours without having a judge sign an order of protective custody. If you are determined to be mentally ill, then you will be assigned a court-appointed attorney. Probable cause hearing occurs within 72 hours to see if you will be held for court hearing. Court hearing happens within 2 weeks of the patient's detention. 2 physician certificates must be on file, and your treatment order will be given at that time. Duration of involuntary treatment is an emergency hold, a short-term or long-term commitment, but the structured patient-centered care planning intervention show promises for long-term outcomes. In emergency situations, initiate a temporary hold for a full evaluation and determination of whether further commitment is necessary. It is important to remember that all individuals are granted a process of petition by someone, an evaluation, hearing, and treatment. Court-ordered mental health treatment are mandates to individuals to receive health care services. Preventative measures such as the homeless outreach team, mobile crisis outreach, rapid response, and mental health authorities all reduce the rate of involuntary psychiatric inpatient treatment.